Let's talk about pain relief options in hospitals. There are a few options that you may be given in hospital, and that could be gas and air, which is Entonox, which is a gas that's made of nitrous oxide and oxygen. It's often called laughing gas, and it's given to you via a little a tube, which you basically inhale with a mouthpiece, and it doesn't last very long. It's very short acting, so you breathe on it when you've got a contraction, you breathe on it throughout the contraction, and then when the contraction's gone you put it down and you stop, and then when the contraction comes back you start breathing on it again. And what it does, it just kind of relaxes the body a little bit, makes you feel a little bit sleepy, a little bit dizzy sometimes. Some people can feel a bit drunk or a bit woozy, but it only stays in the system for a very, very short period of time and then it goes. Some women swear by it. They say, yes, it's fantastic, I managed to get through the whole birth with just gas and air. Some women say, no, I felt too out of control, or it made me feel sick. So it all depends on from woman to woman, but it's a good pain relief to have. It doesn't cross the placenta, so it doesn't affect the baby at all, and it's very, very short acting as well. You may be offered some form of opiates. That could be pethidine or Meptid, or diamorphine even. It depends on what hospital you're booked at to give birth, so it's best to ask them what they offer. And that's usually in the form of an intramuscular injection, which goes into your bum or into your thigh. Now, these drugs are quite strong and they do cross the placenta, so they can make baby a little bit drowsy, but it's not usually a concern unless you are about to give birth. Now, if the drug is given too close to the time of birth, so if you were like 9 centimeters dilated, the last thing I would do is go giving you an opiate, because that could make the baby very, very sleepy when they're born. But if you are 4 centimeters maybe, or 5 centimeters, and I think, well, she's got quite a long way to go yet, then an opiate may be the next level up, the next step up from the gas and air, and it gives you the same, it has the same effect as Entonox, but it lasts for longer. It lasts for a few hours rather than just the duration of the contraction. Again, like gas and air, it can make you feel a little bit woozy, a little bit drowsy, and it can also make you feel a bit sick. So what we usually do is we usually give an antiemetic, which is an anti-sickness drug, at the same time, just so it stops you from feeling like you're going to vomit, basically. Now, if you've had gas and air and you've had pethidine and you still feel like you need something else to help you, then you might opt for an epidural. Some women want to opt for an epidural straight away before trying anything else, and that's absolutely fine. Everybody is different. Some people might want to just work their way up and see how they get on with the first two options, and then move to an epidural if they feel that they need to have that. So an epidural is only given by a qualified anaesthetist in a hospital setting. It's an invasive procedure, as the drug has to be given to you into your spine, into your spinal column, what we call the epidural space, which is kind of at the bottom, towards the bottom of your spine. Now, an epidural anaesthesia, when it works, is very good. It offers a very, very good block, so it can totally numb your abdominal area, and it can provide ultimate relief for women. So that is one of the pros of an epidural. Also, if your blood pressure is high, epidurals can lower your blood pressure, which is good for those women who are hypertensive, who have got high blood pressure anyway. Because an epidural is an invasive procedure, there are some risks to it as well. So it has to be done in a totally sterile environment. So nobody, the back has to be cleaned, nobody can touch anything, everything has to be aseptic techniques need to be used, sterile gloves, sterile field, everything like that. There obviously is a small risk of infection, but it's a very small risk. But aside from that, the anaesthetist will talk to you about other risks that are involved with an epidural, such as headaches, tingling, numbness, and some other rarer side effects as well. But that would all be discussed with you if you decide to go ahead and have an epidural. If you have an epidural, depending on the level of the block that's given, you may or may not be able to move your legs. It depends. Some anaesthetists are great at giving what we call mobile epidurals, which means that you can move your legs around. And other anaesthetists give a really, really heavy block, which means you're basically stuck on the bed and you can't move at all. You'll need to be continuously monitored, or your baby will have to be continuously monitored if you have an epidural, because it is an invasive procedure. So you'll be strapped onto a monitor on the bed, and you won't be able to eat or drink anything either, because when you have an epidural, you're more at risk for ending up with a cesarean section because of what we call the cascade of intervention. Because you're not able to mobilize, there's a high chance that the labor might slow down, or baby might become distressed, which means you may end up going into surgery. You'll have to have a drip in your hand, and you'll be given fluids through a drip because you can't drink anything. We don't want you getting dehydrated, so we put a little drip up to help hydrate you. Your blood pressure will be checked at least every hour as well, because like I mentioned before, epidurals can make your blood pressure drop, which is great for those who have got high blood pressure, but not so great for those who have got low blood pressure. If you're thinking about a non-pharmacological form of pain relief, you can always choose water as well. You don't have to have a water birth if you don't want to, but sitting in the tub, sitting in the bath is a great way of relaxing yourself and getting your mindset right as well, and just having that nice, calm, warm environment. So when you're at home in the early stage of labour, or even if you get into the hospital, if they've got baths available, use one of the baths. Maybe not if your waters are broken, but if your waters haven't broken and your care providers are happy for you to get in the bath, then that could be a great way for you to cope through your contractions. The warm water should be able to help kind of take the edge off it a little bit for you. If you do want to have a water birth, again, that's fantastic. And some women can give birth in water without any other analgesia. Some women want to give birth in water but still use the gas and air. It's really, really good to inquire what's available in your local birthing centre or in your hospital to find out which is the best route for you to go down.